Hello, everyone, and welcome to the Coronavirus Virtual Webinar Series. My name is Shonali Paul. I'm the COO of CloudLIMS.com. I'm here to present on the topic, Setting Up a Coronavirus Clinical Diagnostic Testing Lab, LIMS for Automation and Data Management. Please feel free to submit questions during the presentation, and I will send you replies as soon as I can. Today, we are going to talk about the need for rapid testing of COVID-19 or the novel coronavirus infectious disease, the importance in containing the pandemic, the challenges in testing the SARS-CoV-2 or the virus that causes COVID-19, and in the end, how a lab manager can overcome these challenges by using a LIMS and thereby increase the response to the need for testing samples as new cases emerge. As we already know, laboratories around the world are in a race against time, trying to increase the testing of COVID-19 cases and isolate the positives in order to control the spread. The fact that COVID-19 spreads easily makes the case for swift and large amount of testing or mass testing. Detecting the disease allows for quick isolation of such cases and reduces the chances of new infections significantly. So how did this all start? The novel coronavirus is commonly believed to have originated from a bat and only known to be in animals. The virus is known to have jumped to humans in Wuhan in China and began spreading at a fresh seafood market. It belongs to the same family as the SARS or the severe acute respiratory syndrome and MERS or the Middle East respiratory syndrome coronaviruses that emerged in 2003 and 12. We already know that it is more contagious than the common flu, and the modes of transmission include touching of contaminated surfaces or from infected individuals. Studies have shown that the virus is airborne and can spread through sneezing and coughing. Since it is a new virus, previously only known in animals, the human immune system is unable to identify it as a threat. Symptoms for the virus can range from dry cough, runny nose, muscle pain, skin rashes, to diarrhea, nausea, and high fever. Different drugs and therapies are being used to combat the virus. However, at this time, there are no established treatments or vaccines available, although we all know that trials are in place in a rush to produce one. At the time of this presentation, there are over 7.2 million cases of COVID-19 spread over 213 countries and territories worldwide. The United States, Brazil, Russia, Spain, United Kingdom, and India are leading in the number of infections. As you can see, the curve for the daily increase in cases is growing alarmingly, about 127,000 a day. There is an urgent need for aggressive testing in order to isolate the positives for checking the spread of the disease. The emphasis is on testing so as to convert the current situation to a slow pandemic, or for flattening the curve so that it does not put undue pressure on the healthcare system. The chart here is taken from a study conducted by Johns Hopkins University. It shows the projected growth of the coronavirus over June. The 2019 coronavirus, if not checked, can potentially alter the global landscape and change the way of life. As they say, we are already living in the new normal. One of the best ways to curb the spread is via social distancing, use of masks in public, frequent washing of hands with soap, and the use of sanitizers. Equally important is to exercise and lead a healthy and active lifestyle with strong lungs. However, in addition to prevention, testing for identifying and isolating positives is of paramount importance so that the healthy individuals are protected and the spread is restricted. So here's the case for testing, and more testing. The virus is highly contagious. It easily spreads from one person to the other. Factoring in multiple studies, the R naught of the COVID-19 is estimated to be between 1.4 and 2.5, which means one infected individual in the absence of any mitigation can infect between 2 to 3 individuals. Now, this seems like a small number, but when you look at it this way, 1 infects 2, 2 infects 4, 4, 8, and 8 infects 16, the growth is exponential. The seasonal flu has an R naught of about 1. While most people start showing symptoms in 4 to 5 days after getting infected, every 1 in 4 cases can be asymptomatic. This means that such individuals have no visible signs of the infection but are potential carriers and can spread the virus. These individuals could be potential contact tracing nightmares if such an individual is not quickly tested and identified. And the only way to identify such a person is to test and then isolate them. The virus has an incubation period of 14 days. This gives a large window to spread if the infected person is not isolated. With the current strain on the healthcare system and the number of severe cases rising, isolating each positive has become the need of the hour. Isolation and contact tracing could be even more challenging in densely populated countries such as India. Aggressive testing is important for identifying the positives and isolating them so that healthcare facilities are not overloaded with patients and there are no paucity of beds or ventilators or staff to tend to them. So even so that the turnaround times have been slow due to a variety of factors, from lack of in-house trained staff, to paucity of laboratory resources to handle high volumes of tests, and slower than expected test kit production, to actually getting diagnostic assays that are rapid and still accurate in their diagnosis, the challenges that the testing labs have been enormous. As more and more point-of-care test kits are now becoming available around the globe, including in the United States, as a part of FDA's emergency use authorization process, or EUA process in short, one bottleneck appears to be easing up. While we understand that rapid testing is important, many countries have not been able to keep up with the demands of testing. One of the reasons, of course, is not enough labs are equipped with testing of such contagious specimens. And those which are, they are facing numerous challenges. In these times, recruiting staff experienced in handling infectious specimens is a challenge. If experienced staff is not available, training needs to be scheduled. So following SOPs, safety practices in handling infectious samples, and testing is of paramount importance. Testing kits are already limited, and any mistakes will lead to a wastage in time and energy and would have consequences for both the patient and their families. A lab needs to standardize and validate new test methods, and as they evolve, even before testing COVID-19 specimens. Having the test methods in place is vital to the functioning of the lab. Getting supplies such as reagents, equipments, personal protective equipment has been a challenge, with these available in short supply due to these unprecedented times. Meeting compliance is another challenge, particularly that of HIPAA, CLIA, and ISO 15189. Therefore, US has mandated that the tests be conducted in CLIA-certified labs. The instruments used in testing also play a vital role in the accuracy of the results. They need to be properly calibrated, and if not, they could potentially lead to a false positive, or even worse, a false negative. Keeping track of the instrument maintenance and calibration schedules is of paramount importance. Fighting this pandemic is like a race against time. And to win this race, we need to ramp up testing and reduce turnaround time. The way to overcome the challenges we just discussed is to build an automation pipeline using robotics and to use informatics tools such as LIMS. At University of California, Berkeley, at its innovative Genomics Institute, they rapidly repurposed a 2,500 square foot scientific lab into an automated diagnostic laboratory. The facility was testing 1,000 samples a day, and with a robust robotics pipeline and informatics support, the daily testing could be ramped up to 3,000 samples a day. So this is the power of automation and informatics that we're about to discuss in the coming slides. In a typical lab setup, and it may vary from one lab to another, a clinician registers as a client in the LIMS. This registration helps him register samples with the testing facility. A test request is sent and the samples are shipped to the facility. The lab manager receives the request, accepts it, receives the samples, stores them, and then assigns a qualified technician to conduct the test. The test results are recorded, validated by a supervisor, and then reported in a pre-approved format templated as per CDC and FDA guidelines in the US. The samples are then removed from the facility after a stipulated number of days. So how does a LIMS help in automation? A LIMS has sample management, test management, workflow management, personnel management, instrument management, data management. It can generate reports and meet compliance. And we shall discuss these in the upcoming slides. So how does LIMS manage samples? Now, laboratories are receiving a deluge of samples. There are in these times, and managing the samples is an onerous job for them. With the LIMS, it may not be. Each sample received can be tracked through its life cycle in the lab. Right from the time it is received, the sample metadata is stored in the system. As it moves through different processes, the sample status is maintained, whether it is being received in the lab, or if it is being stored, or if it is under testing, or a result is already available. At the same time as it passes from one custodian to another, an audit trail is maintained. The LIMS therefore serves as a guide for not only maintaining the sample data, but also in understanding where in the laboratory workflow the sample is. Sample tracking also can prove to be a challenge if a LIMS is not available. After a sample is received, it may be lost if the storage location of the received sample is not maintained. A LIMS provides a virtual storage setup and enables visualization of the sample location. So at any given time, if the sample is not being processed, the lab personnel know exactly where it is stored and therefore from where it can be retrieved. We all know that sample data without patient information is incomplete. A LIMS maintains the patient's age, medical history, lifestyle details, comorbidities, which may help clinicians to raise a flag. So when a sample comes in, a LIMS enables the administrator to de-identify the sample by assigning an internal sample ID. And anonymization is a part of HIPAA. And with the stigma surrounding COVID, this could prove to be a useful tool in the current scenario. So in short, all personally identifiable information is blanked out, as you see from the process in the third column, which means the PHI can be made accessible only to personnel that have the rights to access it. A digital signature is required before unmasking of the data in line with the 21 CFR Part 11. The other challenge is to track the TAT, or the turnaround time for a test. If the start and the end time of a test is available, the LIMS calculates the TAT, and then it flags the tests that lie outside the expected TAT. This functionality enables lab managers to track the efficiency of the lab and take steps in removing the bottlenecks that affect the TAT. The factors that can be affecting the TAT could be inadequate inventory, delayed approval processes, staff competency or training requirements, and these can be effectively addressed by the lab manager to bring the TAT within acceptable limits. One of the primary requirements of a diagnostic lab is generating reports. So a LIMS allows laboratories to easily report the test results. Using a LIMS, a lab can design multiple reporting templates and meet reporting requirements easily. You can add graphs, flags, your logos, signatures. You can insert comments on the observations and report and meet the reporting guidelines set by the government bodies such as FDA and CDC if you're in the US. Here is a report displaying results from a quantitative ELISA test. A LIMS can help you shift the reporting to your clients online and help them access information through a secure and flexible portal. After configuring the catalogs and tests for the services you offer, they can be made available for selection through a client portal. Clinicians can log into the client portal, submit samples, and specify the tests to be performed. Since you know that the tests are requested, provisions can be made to accommodate the request. Clinicians can get real-time access to sample analysis processes, get notified when the reports are available in a quick, easy, and secure process. The reports can be securely downloaded from the portal. Typically, a 128-bit encryption is employed for a secure transfer. After the reports are accepted, the invoices can also be delivered electronically. This automation eliminates paper reports, brings down customer service calls, and saves time spent on handling status-related questions from clients, freeing up your staff time and saving resources. A major requirement of a lab is to maintain stock. Imagine having a bunch of tests to perform, but running out of testing kits, or even worse, PPEs or masks or gloves. Running out of even one of such items can dramatically bring down the number of tests that can be conducted on any given day. A LIMS enables you to keep track of inventory. For those running low, it sends an alert to the lab manager so that it can quickly take stock and place an order. Since the lead times are higher than usual in these unprecedented times, it is advisable to keep the thresholds higher so that your stocks are replenished even before you run out of them. A laboratory needs to ensure that the equipment used for conducting the test is well maintained and properly calibrated, without which the results cannot be assured. A LIMS maintains a list of equipment, their spare components, and it keeps stock of the spares so that you always have those in case an instrument breaks down. It keeps track of the technician responsible for the equipment. It maintains the date on which the maintenance took place and schedules upcoming maintenance and calibration dates. The lab manager receives a reminder ahead of time so that lab activities can be scheduled for maintenance days. You can also add purchase information such as model name and number, serial number, warranty period, purchase date, and the vendor contact information. One of the chief jobs of a LIMS is to integrate with instruments that are available in the lab, primarily for maintaining data integrity and for maintaining efficiency in the lab. A LIMS should upload time-scanned reports being generated by these instruments so that time is not lost in entering the information manually and the results reported are accurate. RT-PCR systems such as those which are currently being used from Hologic and from Abbott are used for COVID-19 testing. It is imperative for you to have your LIMS integrated with such systems and other point of care equipment so that it helps maintain data integrity, avoids costly errors, saves time and resources. Now, laboratories have several documents. These could be SOPs, test methods, instruction manuals, lab notes, and they need to be centrally available for all staff working on the test. All the staff needs access to the latest versions to the SOPs and manuals. So a LIMS helps maintain and track all the documents, the version numbers, and the date of modification. Furthermore, you can easily associate these documents with tests and instruments, such as in the current scenario when protocols are constantly changing as we learn something new. Each day, new guidelines emerge. We need to ensure that the latest version is associated with the COVID tests for all the staff to follow. If the older version is used by any chance, the results cannot be approved and a retest would have to be conducted, losing time as well as wasting resources. One of the most important resources available to a lab manager is his staff or personnel. A LIMS helps you keep track of the staff's technical competence and helps identify training needs. A LIMS helps you manage staff records along with their education, qualification, training, technical knowledge, skills, and experience. Knowing this information, a lab manager can identify additional training requirements for handling the current situation. For example, using biosafety cabinets or handling hazardous specimens. It helps manage different pieces of training required for the staff. These trainings can then be assigned and marked as complete when they are done. Such trainings also help identify the staff that are competent to be assigned the testing of COVID samples. A LIMS will stop you from assigning testing to staff still undergoing training. It will also help you identify resources that are trained but are not yet assigned a job, which means you can use your resources to your maximum capacity. So to summarize, a LIMS helps you easily track a sample's journey in the lab, right from collection till disposal. It ensures patient confidentiality and enables following HIPAA guidelines. It integrates with instruments to load accurate test results with ease. It helps manage instruments, their maintenance and calibration schedules, as well as integrates with instruments to maintain data integrity. It also maintains quality measures via proper documentation and staff training. It also helps you generate custom test reports that comply with federal reporting guidelines. Thank you for your time and attention today. And as a reminder, I'm happy to take questions. Please email them to Labroots or to the email address provided on this slide, and I will reach out to each one of you personally. Thank you once again.